Share on recording. Share.
Good afternoon.
Yeah, good afternoon, ma'am.
I am Kamaldeep Peter, the anchor of this talk show, a breast cancer survivor myself. On behalf of the Apollo Cancer Centers, it's a very warm welcome to our, esteemed panelists for the talk show and all our viewers. It is said there is a lot of strength in unity. And through the month of March, it's so visible as world over, people are connecting, collaborating, and issues that matter to women are at the heart and center of every discussion. Yes, March brings in its flavor, its fervor of the International Women's Day, and we celebrate every woman and many women who have blazed their way to set examples to the world. Every issue, as I said, social issues, cultural issues, economic issues, health aspects of a woman matter. And I think it should be a loud shout out to the Apollo team, an incredible, respected brand among the hospitals who has designed a special series through every Saturday of March to zoom in a very important aspect of women's health, and that's breast health. This is the second session we are having today. In the first session, for those who joined us, you must be versed about what we discussed. It was data-driven, evidence-based statistics about the growing incidence of breast cancer. Yes, one side, we find on one front, a lot of stupendous effort has been made by researchers, doctors, pharmaceuticals, and cancer is better handled today. But what could be the reason in the rise of numbers? So after discussion of the incidences, the growing trend in breast cancer, the signs, the symptoms, how to feel a small change. It can begin with just a murmur, but before it takes a big form, Dr. Jayanti, who is with us again today, she told the viewers when you should get alert and how and when and where you should be reporting to an breast oncologist. Today, we'll take that discussion ahead. We will be talking about screening, ways of screening to distinguish whether it's malignant or, a lump is non-cancerous or malignant. But we are so privileged that on our show, we have some amazing personalities with us. Sihi Kahi Geetha ma'am, a warm welcome to you. To my viewers, I must say, to our people who have joined us, she is an Indian actress, writer, and a voiceover artist known for her work in Kannada cinema and television. She has a diverse portfolio of assignments and achievements. She's worked as a dubbing artist in 463 films. First, let me applaud to you, ma'am.
Yeah.
Lent her voice to Suhasini, Khushbu, Revati, Urvashi, whom I've only seen on the screen, but ma'am has lent her voice to them.
Thank you.
She's worked as an RJ in Big 92.7 FM for 3 years consecutively. She has won the Best RJ Award by Indian Radio Forum. What an achievement, ma'am. Not easy to go out of the air each day.
Yeah, great.
Thank you.
She has written stories and screenplays for over 1,000 episodes of TV serials. very popular and remembered to this day as a voice of ETV Kannada for about a decade. Sihi Kahi was the first ever regional language TV serial that came out in India and on its national network, Doordarshan. What an honor to have you, ma'am, with us.
Thank you. Thank you.
And you bring along your very accomplished daughter, Hita. And Hita, welcome to our show. And Hita is a very talented daughter of Sihi Kahi Chandruji and Sihi Kahi Geetha, both well-known actors. And Hita has established an identity of her own, deriving a lot of inspiration from her gifted parents. Someone to watch out, friends. She works in Kannada films. She rose to fame with the 2017 film 1/4 kg Preeti. And in 2016, she participated in the reality television show Dancing Star, where she won the title, which was aired on Colors Kannada. What a performer you are, Hita.
Thank you.
Currently, she is acting with well-known stars, and she is also married to Kiran Srinivas. We welcome you, and I'm sure you'll bring the energy and the perspective of a youth to our show.
Thank you. Thank you. I will try my best. Thank you.
Yes. And Dr. Jayanti Thumsi is the medical expert of the session, and around her revolves this entire talk show. She needs no introduction, but then it's always my pleasure. She is a lead surgeon, breast oncology at the Apollo Hospital in Bannerghatta in Bangalore. She graduated and completed her MS in general surgery from Grant Medical College, JJ Hospital, Mumbai, and she has undergone training in breast oncology at the prestigious Tata Memorial Hospital, Mumbai. She's been practicing breast oncology in Bangalore for 21 years. Vast experience, performed more than 3,500 breast surgeries, 2,500 plus other surgeries, with an expertise in breast conservation and breast reconstruction surgeries. She has a keen interest that makes her stand out as a doctor to create awareness in women about breast cancer, and has been very active in conducting more than 258 awareness camps and educated. I looked at the number twice. 4,58,000 women so far through her TV shows, radio programs, written newspaper articles, YouTube videos, Facebook Live programs, and today's health edition by the Apollo Cancer Center is the brain work of her, along with the amazing team she has at her hospital. She is also an author of a book in its 4th edition, Lump to Laughter, which highlights the emotional journey of women going through breast cancer, rightly celebrated, and she's been crowned with numerous awards. A Woman Achiever of Karnataka 2019 by the VRL Group, Vijayvani and Digvijay TV. Kengal Hanumantaya Prestigious State Award 2019 for her work in the field of breast oncology and her contribution to society. The Chanakya National Award, a jury special award for medical inspiration, truly an inspiration to every one of us. And this she got it from the Public Relations Council of India and the World Communicators Council on 6th March 2020. And she's very well known. At least all of us who are in her support group know her as the founder, member, and managing director of the CREST Foundation, which is an NGO working to reduce the burden of cancer in our society. And I was very happy to be a part of something unique she did, the world's largest campaign for breast self-examination, in which, please listen carefully, 2,332 women They taught breast self-examination in a single day. This event has a world record and has been recognized by the Limca Book of Records.
Wow.
Amazing feat.
Yeah.
She has a lot of papers. She's represented her work at various national and international journals. But something that is so special about Dr. Jayanti is she's so grounded, she's so connected, and we all just adore her and love her. Dr. Jayanti, it's such a pleasure. You are the expert. But before I hand it over to all of you, we have another beautiful woman in our midst. I'm sure you got me right. Dr. Mrs. Deepa Raghavendra Deshpande. And
Hi.
she comes in a very happy state of mind. And to my viewers, I must say she went through the ordeal of breast cancer, but today she is here to share her experiences and to add hope into the lives of many who feel cancer is fatal. And break the bias is the theme of the International Women's Day celebration. And through our first session, it's our commitment to break bias, unjustified fears, stigma, myth, and to make the image of cancer more sober to the public, not to fear it. And Dr. Deepa Deshpande herself is a doctor. She is a family physician, and her special areas of interest are gynecological health, pregnancy, and infertility. She has the keen sense where she can diagnose gynecological malignancies and at an early time or an early stage, and she gives the advice regarding the investigations and how to go ahead with managing the disease. So friends, we are now going to zoom in to all that matters about breast health in our second episode.
Thank you.
Thank you. Thank you very much, Kamal. That was wonderful and very, very happy that all of you are part of it. And I think we should begin the session. Thank you.
Yes. We are really honored to be a part of this wonderful panel. Thank you.
Thank you for having us.
Yeah, thank you.
So my first question is, what are breast cancer symptoms?
Right. So, like we had discussed in the last part, okay, I will briefly tell you, breast cancer can begin as a lump or a swelling, which can happen either in the breast or in the underarm. An important point to note here is that the lump is very often painless to begin with. And that can be very confusing for a lot of people. Just a minute, can we mute others, please? Yeah.
Yeah, I think there's an echo. Yeah.
So it can begin as a painless lump, and just because there is no pain associated, everything is well is not true, right? So if you notice a lump either in the breast or in the underarm region, it's important that you go and meet a doctor and get yourself properly examined. Second symptom to remember are skin changes. Normally the skin over the breast or in the underarm region is smooth. Sometimes this can change. The breast can seem as if it is pulled inside, or there may be rashes, or there may be redness of the skin. Skin over the breast or in the underarm region. And third important thing to remember are the nipple changes. Normally the nipple outwards. Please mute the others. Please mute the others. Somebody has to do it. There could be nipple changes. The nipples are normally pointing outwards, but it can change. It can become crooked, or it can go inside. There could be a wound over the nipple, or sometimes there can be discharge that coming out of the nipple, some kind of fluid flowing out. So if you find any of these symptoms, it does not necessarily mean it is cancerous. In fact, 80% of the times it is not cancerous. But the 20% of the time when it could be cancerous, we do not want to miss out on early detection. And hence, if you find any of these symptoms, without wasting time, go and see a doctor. Let the doctor examine, do the necessary investigations, and then we will know what the problem is, and treat it accordingly.
In my 30s, I mean, late 30s, even I have noticed a lump in my left side of my breast, and I got this mammogram test, and I consulted a doctor called Dr. Girijama, and she treated me, and they said it's just a fibroid, not anything related to cancer.
Right. So yes, that's why we do number of investigations, just because there is a lump or there is a pain, or, there could be nipple discharge or skin changes. Like I said, 80% of the times they are not cancerous. So to decide which are the ones which are cancerous and which are not, we do certain investigations. And investigations are basically like ultrasound of the breast, what we call as sonomammogram, a mammogram of the breast. Sonomammogram and mammogram are different. Many times, a lot of women get confused about it. Or we also sometimes do a test called breast MRI. So these are the different investigations that we do, and each one has a different goal. When a young woman comes to us, we probably will first do an ultrasound of the breast, to find out. But for a woman who is 40 years and above, only ultrasound may not be enough. And each investigation gives us a different information that we are looking for. Very often women feel, I just did an ultrasound, now you're asking me to do a mammogram, and then now you're saying an MRI. But we definitely need the different investigations, because the information that we receive by these investigations are different. Now, mammogram is a kind of X-ray we do of the breast. It's an X-ray we do of the breast. It is not a very useful investigation for a woman who is young, basically because in a young woman, the breast is very dense, and as a woman approaches menopause or after menopause, the breast tissue gets replaced by fat, and then mammogram is a better investigation. But mammogram is extremely important because it can pick up an abnormality in the breast when it is so small, so tiny, that it could be just few millimeters in size. Even before a lump is felt with our fingers, for us to feel a lump, the lump has to be big enough.
Yeah.
Even before that, an abnormality can be detected by a mammogram. And mammogram, of course, is good for women who are 40 years and above.
Doctor, I've heard that mammogram is very painful, and usually women are skeptical to go ahead and get a mammogram done because it is a perception that has been, I think, widely spread, that it is extremely painful, and that is one question. Another question is that, is it necessary for a woman, like you mentioned, who's reaching 40s, to actually get it regularly checked, or like, say, even like, I'm in my 30s right now, I've just started my 30s. So how would it be? What would you recommend when I should start getting it done? Because a lot of hospitals have these health packages now where you can go get your health checkup done, and mammogram is like one of the main things for a woman to get done. So what would you recommend?
Right. So yes, a very good question that you asked, that mammogram is painful, right? Well, so I ask all the women this question, and I'm sure many of you have heard me asking this question. Do we get our eyebrows done? Yeah. Do we get waxing done? Is that painful or not?
It is.
Yeah. So we are ready to go through that pain to look good. Yeah. Mammogram is a momentary discomfort. It's not painful. And now that there are so many high-end machines, mammogram machines, the pain is really, really less. But we need not focus at the pain or the discomfort which is there just for a fraction of a second. what is more important is what advantage do we have because of it, isn't it? To date, there is no other investigation which has replaced mammogram. There has been many endeavors. Lot of people are coming up with newer modalities of investigation, which are all in the clinical trial mode right now. But as of now, there is no other investigation which can replace a mammogram. What information we can get from mammogram cannot be got by any other modality. At the same time, mammogram is not completely foolproof, so it has its limitations. For somebody as young as you, less than 40 years of age, I would not recommend a mammogram as a routine unless a young woman has some problem in the breast and we as doctors examine it and we feel that yes, there is something suspicious, let us get a mammogram done. In that case, only mammogram will be done. But for all women who are 40 years and above, if we are doing a health check, I would certainly recommend that yearly mammogram, please get it done, because we know that the incidence of breast cancer is on rise. It can strike any woman at any age, So it's better to be alert.
Okay. Thank you, doctor.
How long should one wait to get the clinical tests? Like after the breast self-examination?
Mammogram or self-examination.
Self-examination.
You mean to say after you detect something, right? So before that, let me tell you a little in short about MRI. Breast MRI is another investigation that we do. I think we had done it on Dr. Deepa. Am I right, Dr. Deepa? Did we do a breast MRI? You're on mute, Dr. Deepa. You're on mute. You need to unmute yourself.
Am I audible, ma'am?
Yes.
Yeah.
So did we do a breast MRI on you?
No, ma'am. It was only mammogram and ultrasound of the breast,
Okay.
FNSC.
Yeah. Right. So many times in young women, like I said, in young women, mammogram may not be very informative. And at the same time, we're also saying that the incidence of breast cancer is on rise in younger women. So how do we detect, right? So that is when breast MRI comes into help. Breast MRI gives us additional information that we look for, and mammogram or MRI or ultrasound also helps us not only in diagnosing the disease, it also helps us in planning what kind of surgery would be appropriate for the patient.
Yeah.
This question is to Dr. Deepa. What
Yes.
kind of treatment did you go through, Dr. Deepa?
Yeah, actually, after my
how long it took you to get diagnosed the cancer?
no, it was just a one day, because I had symptoms like heaviness in both the breasts, and I did not waste time in giving a second thought for that. I directly went to the radiologist, who is very experienced, and she is attached with a diagnostic laboratory that has got very latest machines. That is also important, because a nearby laboratory or an unexperienced doctor may miss the smallest and deepest lump. So I went to a good experienced radiologist, a friend of mine, and within no time, on ultrasound only, she diagnosed that there was a small lump, very tiny, just 1 centimeter into 0.5 centimeter. And that was very deeply seated. Though I was doing my own breast examination very regularly, I couldn't get that actually. But she caught it within few seconds. Then she asked me to go ahead with mammogram, and mammogram definitely confirmed the same finding. Then she asked me to go ahead with FNSC, that is fine needle aspiration cytology. And that is also very painless, because whenever the word needle comes into, everybody gets upset. So, but it is, in fact, we don't need any local anesthesia or any anesthetic spray also. So it's so painless. and it was done under ultrasound guidance. So there won't be any blind prick or anything. And I got the report of that needle aspiration cytology by evening, and the diagnosis was confirmed. Like it was the ductal carcinoma, which is supposed to be the worst of all carcinomas of breast, fast spreading and has got a very bad prognosis. Then that was, all these things were done in one day. That's it. So by the end of the day, I was sure about the diagnosis, you know. Then very next day, I went to Dr. Jayanti Thumsi. I know her very well from the beginning, and her expertise are known to whole of Karnataka and even Maharashtra, and in fact the world. So I went to her. She asked for few other blood investigations, regular routine tests like thyroid and sugar and other things, just to rule out other comorbid conditions, and ultrasound of the uterus, ovaries, X-ray chest. That was a routine to plan for the further surgery and all. That was a pre-workup for the surgery. And when I met Dr. Jayanti, she told me in a very planned way. Like she said that it's a very tiny lump, first of all. So she explained the way the surgery, like she said that she would take out the lump along with the normal healthy margins of the breast. So not only the lump, but the healthy margins around
Yeah.
it, and almost 2 centimeters. It's not just a small brim or anything. She's told me that she would remove 2 centimeters of healthy breast around the cancerous lump,
Yeah.
And on table, like during the surgery itself, she was supposed to send this removed lump along with the healthy breast tissue to the laboratory in the same hospital, and the pathologist was supposed to be there along with her, or in her lab, of course, a well-equipped lab. I would definitely like to mention this part again. And I was right. I mean, the patient will be under anesthesia in the operation theater on the operation table, but the lump will go to the pathologist. She will analyze the lump and the healthy tissue around. And if the healthy tissue is infiltrated with micro tiny cancerous cells, then the pathologist would inform the oncosurgeon, Dr. Jayanti, about that. And if it is showing some infiltration of microscopic cancerous cells, then the plan was to remove the whole breast. That is called as radical mastectomy. But in my case, because it was a very tiny lump, and I'd never wasted time in getting it diagnosed. My area involved was very small. There were no infiltrations in the surrounding area, and she just took out the lump. That's it. She closed it and came out of it. So it was just a lumpectomy, removal of the lump. So in medical terms, it is called as breast conservation surgery. So I could, Dr. Jayanti saved my whole of the breast and took out the small lump. That's it. So that was a great thing for, that will be definitely a great thing for any woman for with this problem, So that was the thing, how it went on. But that is not the end of the thing, After this lump is removed, once you go home, and very next day I was sent home. I was discharged from the hospital. I was very comfortable. There was no pain, nothing, with a small bandage and a drain pipe. That's it, which was very painless. Then this lump that they have taken out, that will be sent for further investigations. People always think that, yes, now I'm off the lump, I'm off the disease. No, the story doesn't stop here, that lump will be sent for further special tests, like recognition of receptors. There are particular receptors which are responsible for this type of cancer, and genomic tests also. So
And
those
about
tests,
screening, I have again a doubt, Doctor. Dr. Deepa, I'm just coming
Yeah.
in because I thought
No
I'll
problem.
just ask a
Yeah.
question. Because for me,
Yeah.
of course, mammogram was done and sonomammogram, but I also went through a PET scan.
Yeah.
So what was it, Dr. Jayanti, about the PET scan? Like, does everybody have to go through a PET scan before the surgery, or what are your, please throw some light on this.
Right. So PET scan is an important investigation which is done to detect if the disease is confined only to the breast or has it spread to the other organs. As we know, the property of cancer is a cancer cell has a property of spreading, of dividing fast, growing uncontrollably, and it can spread to the other organs. That is where what we call a staging of the disease. So to stage the disease, very often we do a PET CT scan. But PET CT scan is not mandatory for everybody. According to the international guidelines which are there, if the patient, when we examine or by doing a mammogram and by doing a biopsy, if we detect that this patient is in stage 1 or stage 2, then we will not do a PET CT scan. When we detect it is in stage 3 or stage 4, that is when a PET CT scan is done. However, for very young patients, again, maybe we would do a PET CT scan, and hence it may not be required to do for everybody.
I did not require it actually.
No, she did not need it. And also, I would like to tell a little about the needle biopsy, which Dr. Deepa told us that. So there are what we call as triple assessment. To when a patient comes.
Doctor, you're on mute, doctor.
You're on mute.
Yeah.
Suddenly you went on mute, doctor.
How did I go on mute? Okay. So I said that when a patient comes to us with a breast lump, there is 3 things are important to assess, which is called as triple assessment. One is examining the patient, taking the complete proper history. Second is doing imaging, radiological imaging. That means, like I earlier said, either ultrasound or a mammogram or an MRI as required. Then the third important thing is biopsy. Biopsy is where the histopathology, where we put in a needle into the lump, we take out a little tissue, and this is examined under the microscope. So final biopsy is the one which gives us a final diagnosis. Biopsy are again of 2 types, like Dr. Deepa said. It could be a FNAC or what we call as a core biopsy, and none of these are painful. They're just outpatient procedures. When we were studying, biopsy itself was like a small surgery. Now things have become so convenient, and so easy. It is just an outpatient procedure. Women come to us, we do a biopsy, and then they go to work. It's like that.
Yeah.
So these are few of the investigations that we need to do to find out what is the kind of lump that we are dealing with.
Doctor, I wanted to know, I think Dr. Deepa, because she herself is a doctor, she had the knowledge of who to go to and who would be the best to treat her. But for a common person, for a common woman, how to choose the doctor and who should they go to first?
So,
Well, that's a good question and a very complicated question for me to answer. I'll tell you why. Okay, traditionally in our country, when a woman has a problem in the breast, she likes to go to a lady doctor. Nobody wants to go to a male doctor to get your breast examined unless it's inevitable. So in our country, there are not many females who are surgeons. Okay, so traditionally women go to a gynecologist who is a lady. Okay, but they are, by experience, they have learned to deal with breast related issues, but they have not studied it as a curriculum in the medical field. This is studied by a surgeon, not by a gynecologist. So a woman needs to go to a surgeon. Now there are sub branches. Now there are breast surgeons like I am. It's a newer field after surgery. There are people who do dedicated work in breast related issues, So you should go to a surgeon. There, a breast surgeon may not be available everywhere, because it's not very common. You need to actually go to a surgeon, or if your gynecologist sees you and does the basic investigations, then probably she will refer you to an oncologist or a breast surgeon. But in other countries, it's different. Patients directly go to a surgeon.
Yeah, but then, doctor, I've heard of so many people losing time.
Right.
They went to the doctor said, fine, you don't have to worry, but the symptoms recur. Then they go to the breast oncologist.
Yes.
So, I think we can avoid that delay.
And also the pandemic situation also made
Yes,
delay in patients.
Yes, Geetha, I completely agree with you. So many patients came to us with an advanced disease, because as it is, women don't want to come to a doctor, and pandemic
was also the same thing happened.
And pandemic was the best excuse not to go to a doctor. So as it is, there is a delay, and that added to a lot of things. Yes, there was a phase where we saw a lot of women coming to us with an advanced disease, losing out a vital time, So whatever it is, cancer is an emergency of its own. So in spite of pandemic or anything else, if you have any suspicion, it's important that you go to a doctor and get yourself examined.
Doctor, how to prevent? Everybody says that using every day this deodorants, roll-on, and body spray also causes cancer. Is that true?
Yeah, there are many studies which are coming up that the chemicals in the cosmetics or the deodorants can raise cancer risk. It's a good question, but as of now, the studies are in progress. To date, we do not have any concrete detail to tell you that yes, a roll-on will cause cancer, or this particular cosmetic will cause cancer. We have no such clear-cut ideas yet. So the research is still on, the studies are still going on, and it takes a lot of time. It takes the processes take a lot of time. So as of now, I have no answer for the question that you have asked.
And also they say using the padded bra, and even that causes
underwired bra.
Yes, that's a very good question. That's so what kind of bra a woman wants to use is completely a personal choice. Okay, there is no bra which is associated with increased risk of breast cancer, whether it is padded, unpadded, wired, unwired, tight, loose. Some women colored bras, or some women prefer not to wear one. So it is completely their choice. It has no known risk of increasing breast cancer. However, I would recommend that one uses the cotton undergarments, because not that the other ones cause cancer, no, not that, but cotton is a natural fabric, and it is good for your skin. It absorbs sweat, and it is healthier for the skin, and I would recommend that women use the cotton undergarments.
Doctor, one very important question I have. How do you advise people who should go for genetic testing and who should not?
Wow, that's a very good question, and that's a big topic, and it's my favorite too. Well, this genetic testing is a testing which has been done since many years. For a very long time, it was not available in India. All right. When we were studying, it was not there. It was not available in India. But now, fortunately, there are many wonderful laboratories which are there. The companies which are there, which do the genomic testing, the genetic testing. And earlier, it used to be exorbitantly priced, and now it is very affordable. Now, who should get a genetic testing done? Now, a lot of women come to us saying that, am I at risk? Shall I get a genetic testing done? Well, no, not that. This testing is indicated for everybody. There are some women, particularly women who have a strong family history of
Yeah.
breast cancer or ovarian cancer or any other kind of cancers, So a woman already has a history in her family, and such a woman is now worried, what are my chances? Or if we are already treating a patient who already has a family history, so for their children or their relatives, then maybe we would recommend that you should get a genetic testing done. Secondly, if a very young patient, less than 40 years old, develops breast cancer, actually less than 50 years old, premenopausal, what we say, before the menopause occurs, if somebody develops breast cancer or ovarian cancer, in that cases also we would do a genetic testing. There is one kind of breast cancer. Now, breast cancer, all of it is not alike. Breast cancer has hundreds of varieties in it, and each one has a different treatment. So there is one particular type of breast cancer which is called as triple negative breast cancer, what we call as TNBC. In such patients also we ask for a genetic testing. And if there is a male breast cancer, breast cancer can occur in men as well, though the incidence is much, much less. It can occur in men also. If there is a male patient who has developed this disease, even in them, we would ask for a genetic test. I'm sure all of us have heard story about Angelina Jolie, right? Angelina Jolie had a very, very strong family history of breast cancer. Her mother, her aunts, and many people in her family had developed this disease. So she herself wanted to know what are her chances, what is the risk for her to develop this disease, and hence she did the genetic testing, and it was detected that she had an abnormal gene in her body which caused breast and ovarian cancer, what we call as BRCA gene, and BRCA gene was mutated, meaning it was an abnormal gene, and this abnormal gene was running in her family. It was being transmitted from one generation to another generation to the next generation, And when she did the BRCA testing, she was detected to have this abnormal gene, and hence, before cancer could occur to her, because she had this abnormal gene, she was told that she had 87% higher risk of developing breast cancer and 50% higher risk of developing ovarian cancer. And hence, before cancer developed, she took necessary actions, She did certain necessary things which she had to do, and today she is free of the disease and free of fear of developing this disease in the future. So why I'm giving you this example of hers, because she has been vocal, and because of her, more and more people got to know about these tests. But more importantly, why I'm telling you this is that all these facilities of doing the tests or taking the necessary steps to prevent the disease from occurring is available in India. We regularly do it in our department at Apollo Hospital, and it is all at an affordable cost. So people who have a strong family history of cancer, do not be stressed all the time. You can actually detect what are your chances of developing this disease and take necessary action before even the disease develops. All this is available. So I think on Dr. Deepa, did we do the test on you?
Yes, ma'am.
We must have done the BRCA testing on you.
Yes, doctor. But
Okay.
fortunately, it was negative.
Okay.
And even my ERPR was positive.
Right.
HER2 new was negative.
Right.
And BRCA was, of course, negative.
It's negative. Yeah. So doing BRCA does not only determine the risk of developing this disease, it also helps us in planning the kind of the treatment,
Yeah.
The kind of surgery that we do, or the kind of sometimes chemotherapy is needed, the kind of chemotherapy that we use, all of this, it has therapeutic implications, meaning it helps us in planning the treatment as well.
Yeah. And because of that, I did not require chemotherapy. My type was ERPR positive and HER2 new negative, and BRCA was negative. So I was not advised chemotherapy.
Yeah, not that because of this chemo was not detected. So we had done one more test on Dr. Deepa because some people who have early disease, some people like she had very very early disease and very favorable disease that she had. Earlier we would give chemotherapy for all these patients. Chemotherapy is another modality of treatment. And it was soon realized that many of these women actually did not need chemotherapy, yet they were given, because in the earlier days we had no way to distinguish, or there was no test or no methods to distinguish who are the subset of these women who had early disease, who actually will benefit by taking chemotherapy and who do not actually need the chemotherapy. So there are these what are called as assays. We do the genetic assays where where we can actually determine. We do certain tests, certain genetic tests, or what we call as immunohistochemistry markers on the tumor tissue. We do it on that, and that can tell us whether a woman really will benefit from chemotherapy or not. And in case of Dr. Deepa, it was determined that she actually would not have any extra benefit by giving her chemotherapy. Hence, such women need not have to go through all the side effects which come along with chemotherapy. So we've come a long way. I'm just trying to tell you that so much research has happened. Now today is an era of personal medicine or individualized treatment. There is no one size that fits everybody. It's not like there is just one kind of treatment. Any breast cancer patient give the same treatment for everybody. No, that is not what is happening. All right. So we actually individualize, we try to understand what is the kind of the disease that particular person is having, and then treat it accordingly. So that is why she was spared of chemotherapy.
I was very happy to that day, that particular day, when I got to know that, yes, I don't require chemotherapy.
Yes, that's right. But one need not fear about chemotherapy. We have Kamal here who has received chemotherapy, and look at her, who can make out that she's gone through all this.
Yeah, very true.
So, so one need not fear. It's just that, somebody may need it, somebody may not need it. We have to take it as it comes,
Yes.
So even if chemotherapy is needed, it's okay, it can be dealt.
Yes.
And if I remember, Kamal, while she was going through chemotherapy, this is a very interesting story. Normally, a woman would sulk, a woman would whine, and be so down that why did this happen to me and things like that. But Kamal was one person who did not waste her time during chemotherapy. Okay, she has done her MBA course during chemotherapy. Because when she was taking rest, she thought, why should I waste time? And she studied, and she had to complete it, and she did that. So it's so inspiring. Both these women are, Kamal and Dr. Deepa, and it takes a lot of courage to do what you're doing today, to come and say that I am a survivor, breast cancer survivor. And Kamal has been exceptionally doing a great deal of work. She works in Oracle, by the way, and she does a lot of work to spread awareness, and she's known all over India. Anybody wants a survivor to speak, I think she's one person. And you also know she's so articulate and so heartfelt. All their talks are more important than being articulate. It's so heartfelt and it is so touching, so it's really, really amazing.
Thank you, doctor, for encouraging us.
We are mighty inspired by the stories we've heard today, definitely. I wanted to know, Dr. Deepa, how long did it take for you to get back on your feet and, get back to working and practicing again after
surgery? Yeah, after surgery in 10 days time, on 11th day, I was back in my clinic. And on 14th day, I was started with radiation therapy. Radiation therapy is also very, very painless. It is just for few seconds, and I could continue my clinic simultaneously with the therapy. In between, I used to go and get the radiation therapy done and back into the clinic. It was just like an OPD procedure for me, and it was for 34 days. The fractions were counted for me were 34 fractions, and everything was very, very painless. And I really enjoyed, that day. It was just going and sleeping on the bed, forget about the things. In fact, I was getting good rest in between my hectic clinic. And when I was off for 10 days from the clinic, everybody kept on calling. Many patients kept on calling, why is not doctor available? And when I was back in the clinic, no one could make out that I was sick with this disease. Of course, I did not reveal it to them on very first visit or very first few weeks, during first few weeks. But everybody knew that I was not well. But, I was looking very fresh, and there was no sign of such a big disease that I had gone through, or such a big surgery I had gone through. Lots of thanks to Dr. Jayanti for that, and to Dr. Matangi also, because she made the radiation therapy very, very painless and enjoyable rather. So I was back in the clinic on the 11th day of my surgery.
And actually, we encourage patients who are going through therapy to lead as normal a life as possible. Of course, during chemotherapy, there are certain do's and don'ts, but they're not so bad. Like, you're not incapacitated. You can continue with your work. A lot of women continue to work even while on chemo or radiation and surgery. Like I said, Kamal did her MBA during that time. I encourage all my patients to go to work and lead a life as normal as possible. That actually reduces the side effects, and the anticipation of side effects itself causes a lot of side effects, because there's so many people who have heard things about chemotherapy and the therapy in general, that it scares them, it paralyzes them in anticipation. But in reality, actually nothing happens. And most of the patients, after finishing the treatment, they feel, oh, was it only this much? And I was so scared for this, So that's the story we will hear from everybody. So in our department, every new patient who comes to us is connected to somebody like Dr. Deepa or Kamal. We have a huge many number of women like them, and we connect every new patient to one of the patient who has gone through the treatment, and these people are very happy to emotionally connect with them, share their experiences, and give them some tips, like, this is what I did to regain my energy, and things like that. So overall, it's not bad. Cancer is not something you need to be scared of.
No, but
I
it
think
should
it
be
also
diagnosed.
has-
Sorry.
Please
Sorry.
continue.
Yeah, it should be diagnosed at a very, very early stage. We should not miss on that.
Absolutely.
And especially the many ladies in my area where I practice is a low socioeconomic group, So they arrange kitty parties. They arrange parties for, regarding this bishi or what money lending and all. I don't know that particular word, but they get they gather on one particular day of the month, and they save some amount from their pocket money and all. So that type of money transaction they go on doing. But instead of doing that, if they encourage their friends about their complaints and all, come on, we will go ahead with the tests and all. If that type of attitude, if they continue, then probably we will be able to, catch many patients at a very, very early stage.
Like we spoke in the last part, when it comes to breast or private parts of a woman hesitate to talk about it.
Talk about it.
Women feel very shy, and it's a taboo. It's a big taboo topic. I've seen a lot of patients coming to us late just because they did not even share it to anybody in their family, and there are women in their family, not that they have to share it to a man. But we need to change our attitude. Like I said last episode, breast is not only a sexual organ, it is an organ in a body like any other organ, and things can go wrong in it. All right. And unless we talk, nobody will know about it. So do not hide your problems. Feel free to talk about it. Feel free to go to a doctor and get it clarified as to what it is. So that's why I really feel very proud of women like Kamaldeep or Dr. Deepa, who have come out and are speaking it loud, that yes, I had breast cancer and today I'm doing well. It takes immense courage, and I'm sure it will help a lot of women that it's
Yes.
okay to talk about it, right? It's okay
Yeah.
to talk.
And one more thing I wanted to share, even the males in the family, maybe your husband, your son, your brother, whoever, they should also feel very free to discuss about these problems, especially daughter like Hita. Now she knows everything. She definitely more than Geeta ma'am, right? So you should encourage all the ladies, female members in your family to go for annual checkups, master health checkups. Then you can plan whatever is required, not mammography every time for every patient, as Dr. Jayanti said, but a regular annual master health checkup is a must for each and every female in our family, in our circle. If we do that as individual person, then also we can get many patients, at an early stage.
Well, definitely, I had been aware of it, but I think today has given me a deeper insight talking to all of you. I wanted to ask Kamalji one question. You're so inspiring, you're so energetic. Even whatever Dr. Jayanti said about you, I mean, I can see that it's completely true. When a woman or anybody gets to know that they have a disease, and cancer is known to be a deadly disease, how do you keep your mental health, and how do you keep your mental well-being sane, like keep it stable when you know that you're going through something like this? How do you
the family?
how do you cope with the family, all the responsibilities that you have? I would like to know your experience particularly.
Yeah, that's a very good question, because cancer doesn't just hit you physically. It affects you mentally, socially, also financially. Socially, some people don't want to talk about the disease, So the first thing I would like to say is, you need not go announcing your disease, but if somebody asks you for certain reasons when you're away, what happened to you, or checks on to you, you should be telling them, yes, I am going through the treatment, rather than them asking us, I heard you had this. So first you should take it as something that is treatable and curable. Emotionally, like I think through the discussion it came through, we need to be mentally preoccupied. Our new normal, a new normal at life, when we are spending many hours at the hospital visiting doctors, not certain of the outcome, there'll be anxiety, there'll be fear, there will be moments of depression. Because for me it took 6 months to treat. February, when March 1st I was operated, October 10th I finished my complete treatment of 8 chemos and 33 radiations. So it's not no superhuman, spirits are there with us. When we are sleeping alone, at night we are alone, we are thinking what is going to happen. So I kept myself busy. So everybody's cancer is different, but if you can keep yourself mentally occupied at this time, think of helping out someone else. I started, connecting with cancer patients during my treatment, and I realized a word of solidarity with them, telling them you're not fighting cancer alone. gave me strength that I need to prove it, that what I'm speaking. And it was also, so I feel connect with people who have gone through this problem. I connected. I got a lot of tips. I was very close to my doctors. They formed my inner circle of life. I asked them any doubts. I kept my job going. Every day, live the day. Don't plan about 6 months, live it daily, and try to help out someone else. And everyone should be insured. This is something we all should do in anticipation, because cancer can come and affect us financially. But if your finances are taken care of, one level of anxiety is also less. So these are small things, which I felt really helped me to be, and those months passed away. I would tick after every chemo, and I would say, okay, ye bhi ho gaya, ye bhi ho gaya. And finally it was freedom from, and 2013 to 2022, I'm just on hormonal therapy, never miss my annual checkups, which is very important. Reach doctor with all my doubts. And yeah, that's where, thank you for asking me this question.
Thank you for answering. And it really, truly is very inspirational, the way you speak about it, and, your basic, like the state of mind that you have been in since then. Thank you very much.
Yeah. Doctor, there's a question from our viewers. Akhila, do you have the time for a quick answer?
Yeah, I
Akhila,
think so.
unmute.
Let's, yeah, I think
Yeah,
it's
yeah.
already an hour.
Yes, yes, Dr. Jayanti.
Yes.
Can I talk now?
Yes. Go ahead, Akhila. Please go ahead.
Yeah, I'm sorry. I'm actually traveling. I'm in Bangalore right now, but anyway, I can still quickly ask you a question.
Tell me.
Well, I'm a fibromyalgia patient. I have fibromyalgia.
Sorry, I couldn't hear you.
It's been going on since yesterday. So is it required for me to get a mammogram done?
Akhila, I didn't hear your question.
Your voice is breaking, Akhila.
You didn't hear my question.
There's the breeze, the wind sound coming in.
Can you hear me? Hello?
Yeah.
Can you hear me?
Yes, now better.
Yeah, I have this fibromyalgia.
Fibromyalgia.
Yeah.
Okay.
So it's been going on since 6-7 months now. I get, the muscle pain all over the body. So I do get this pain as well. Is it required for me to get a mammogram done?
How old are you, Akhila?
I'm 42.
As a routine, you don't need to get a mammogram done if you're 32. Like I said before, starting from the age 40, I would recommend that you get a mammogram done once a year.
I'm 42. I'm 42.
42, okay. If you're 42, yes, you should do it. Once in a year, please do a mammogram.
But currently,
Get yourself examined.
since 2-3 days, I have a breast pain. So I don't know what to do. In fact, if you know Anju Sridhar.
Akhila, we cannot hear you. Maybe you can connect to us later through Apollo portal. We're not able to
hear me now.
Yeah, no, we're not able to hear you clearly. You're going on and off. You can connect to us through the Apollo portal. Okay.
I think it's time for us to wrap up. So before we conclude, let's actually crystallize our learnings. Doctor started with recapping what she did in the first session about signs and symptoms of breast cancer, lumps, changes in the breast structure, any discharge. I mean, don't delay it. Come to a specialized doctor, and that's an oncologist, a breast oncologist, a surgeon. Have your tests, done. And for that, she's recommended, like, if you even don't have the signs and symptoms, but you have touched 40 years, get into the habit of, having mammogram, etc. periodically, which means your health checkups should include mammograms. And once you go there, it's not necessary that everyone will be asked a mammogram. So don't fear a mammogram. I love the examples of waxing and threading. Yes, it may be a little painful, but it's worth the pain that may come, through the treatment phase. And Dr. Deepa and myself are two different examples. Dr. Deepa didn't have chemotherapy because she had an early stage of the disease. So early diagnosis not only makes it completely curable, treatable, but the ordeal and the duration of treatment is much reduced. So go in for any checkups very early. Start talking about it to people. I found a lot of change. When I invited doctor to my office to speak, people would not attend the session out of a fear, my God. And the biggest risk, which I said in the last session, is the biggest risk a woman can take is to believe that she is never at risk of breast cancer. Anyone, after puberty till 70s and 80s can somehow may develop breast cancer, which can be very unfortunate, but high probability. So take care. And there are various tests by which it will be established. 80% of those lumps can be, non-cancerous. So the fear and anxiety should go. And the underlying theme of the International Women's Day was break all biases. And fear brings in a lot of biases about cancer. So we should shun all that. Medical science has advanced. Let us make it a win-win situation for us and for the doctors. Go to good hospitals, get yourself financially insured. So today's second episode was all about screening, mammogram, ultrasound, FNCA, genetic testing. So a logical continuation would be offered to you next Saturday. And before I actually thank all our guests, Hita, Geetha ma'am, Dr. Deepa, all the viewers, Dr. Jayanti and the Apollo team, I must tell you, it was a 1 hour well spent. What a meaningful discussion. What a connect. Worth it. It will influence and save so many lives, and families will benefit from such a discussion. Like Madam Curie said, nothing in life is to be feared. It's only to be understood. Now is the time to understand more so that we may fear less. So thank you for joining us. Thank you, everyone. It was a pleasure having you.
Thank you.
Our show too.
Thank you. Thank you
Yeah,
very much.
thank you.
Thank you.
Thank you. My mother sends her gratitude. She had to take a leave because she has some responsibilities that she has to do.
Thank you, Hita. And
Very
thank
much
you
for having us. It was absolutely insightful and an honor to speak to all of you.
Yes.
Thank you, Hita.
Thank you.
We will
Thank
see
you, Kamal
everybody
ma'am.
again on next Saturday. Yeah.
Sure.
Yes, same
sure.
time, 4 p.m. And thank you to the Apollo team. Thank you, Dr.
Thank you.
Malika. You're
Thank you.
always there with us. Thank
Yeah.
you.
Thank you. Thank you.
Thank you.
Bye-bye.
Bye.